Everyone always wants to know what the future of dentistry is, and everyone always says, lasers, lasers, lasers. So there are lasers in dentistry, and yes, I've had multiple lasers in the last 20 years. When we do regenerative holistic dentistry that can save the mouth and also kill bacteria, we need to go to the highest echelon of dental lasers, and that's the Periolase laser. This laser wavelength will actually kill the bacteria that cause gum disease. These are the gnarly little bugs that hide deep under the gums that are almost impossible to get at. And this little laser fiber goes under the gums and goes pop, 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 and starts killing bacteria. Very few people have it because the cost of entry is expensive to own the laser, and then getting trained on it, like I said, takes about a year. In 20 years of dentistry, this is probably the best thing I've ever bought. And for me, it is the future of dentistry, the Periolase laser, because of what I can do with it. So a lot of my patients ask me, what is gum disease? Are you saying I have gum disease? My gums don't hurt, I don't have pain in my mouth. Now, a lot of my patients do have gum disease, and what gum disease is a bacterial infection. Now, these bacteria that are in our mouth, the bad ones, usually we inherit, maybe from mom, dad, grandma, grandpa, and these stay with us our whole lives. So what these bacteria do, they start underneath the gums and they start their colonies and they start making acids. They are below your gum line and they start eating away at all the bone and gum tissue underneath your gums. And what you'll notice over time, your gums start getting red, you might start seeing more of the tooth, sometimes even the tooth gets loose. And so that's why you need to come in, don't wait, because we're finding even more studies now showing that these bacterial infections in our mouth, periodontal pathogens, periodontal disease, are linked to our entire immune system and health. A lot of my patients ask, what am I gonna feel like after the laser procedure with the Periolase? And what many of my patients tell me after the procedure was, I had almost no pain. I took some Advil, and maybe I took one pain pill. And what we find is this is a minimally invasive procedure to help reverse gum disease. Now, the old school way of treating gum disease, we had to use scalpels and all these tools to open the gums and expose the bone and scrape the heck out of it. It was brutal. So the laser is minimally invasive, and we're able, with that laser energy, to just kill those bacteria and still be gentle with the gums because, like I said, I want to give my patients a great experience. The recovery time on the laser treatment for full health is usually 6 to 12 months for full healing of the gums and bone. And also for the first month or so, we have special instructions on how to brush your teeth. It's time to do something. These bacteria are getting worse and getting in your bloodstream. We're finding even more studies now showing that these bacterial infections in our mouth, periodontal pathogens, periodontal disease, are linked to our entire immune system and health. Heart health, risk for heart attack, stroke, increases of diabetes, other autoimmune disorders. So we need to get these bacterial pathogens under control. And so that's why you need to come in, don't wait.